The following video is an overview of discharge instructions given to you at the hospital after your hip or knee replacement surgery.
Thank you for choosing Memorial Regional Medical Center for your orthopedic care. When you are discharged home from the hospital after surgery, we want to be sure that you have all of the information you need for a successful outcome. Discharge instruction resources. If you have questions about your discharge instructions, some of your resources include your joint book that was given to you at the joint class or at your pre-admission testing appointment before surgery. You are also given a copy of your discharge instructions by the nurse at the hospital. This discharge video is also available at the Bon Secours Memorial Regional Medical Center website. Follow-up care after your surgery. You will follow up with your surgeon 2 weeks after you leave the hospital. You should call and schedule an appointment the day that you get home. You will also have physical therapy. Some patients go home with home health physical therapy where the physical therapist will come to your house. If you are set up for home health, the agency providing your care will be on your after visit summary given to you at the hospital. If you are set up for outpatient physical therapy, you should call and set up an appointment the day you get home if you're not already scheduled. You should be given a prescription for this physical therapy before you leave. When your nurse gives you your discharge instructions at the hospital, she will let you know how you're getting your physical therapy and when you should follow up. Discharge medications. Your nurse will go over your medications when you leave the hospital. Some of the medications that may be prescribed to you after this surgery include a narcotic pain medication. These are the stronger pain medications that we give you to control more severe pain. Some of the side effects include constipation, nausea or sedation, or sleepiness. We will prescribe you a stool softener to help prevent constipation while taking these types of medications. You may also go home on a non-narcotic pain medicine, such as Tylenol. This is used to treat more mild to moderate pain. Another medication that you may be prescribed is something to prevent blood clots. Your nurse will let you know which medication that you were given, and she will give you all instructions for all medications that you should take when you get home.
Pain management after surgery includes a few things. First, remember to use your ice packs that you were given at the hospital. These ice packs have inserts that go inside, and the nurses will give you extras so that you can have one set in the freezer and the other set on your operative site. Remember to take your pain medication as directed. Use your pain medication log in your joint education book to help you keep track of your doses. Remember, we expect pain after a joint replacement surgery. Pain and swelling are to be expected. What we want is to be able to manage your pain through the techniques that we discussed. And don't forget, other techniques such as relaxation, distraction, and music therapy can be very helpful for managing pain.
Preventing blood clots. Blood clots are a risk of many different types of surgeries. To help prevent blood clots after this surgery, you will be given aspirin twice daily to prevent clots if you're not already taking a blood thinner every day. If you normally take an anticoagulant or blood thinner, such as warfarin, Eliquis, Xarelto, prior to surgery, your nurse will tell you when to restart taking that medication. To prevent stomach upset from these medications, you should take Pepcid or a similar home medication while you're taking the aspirin if you do not normally take that medicine. Your doctor will let you know when you can stop taking these medicines if you don't normally take them on a daily basis. Caring for your wound. Keep your waterproof dressing in place as directed by your nurse. You will be given an extra dressing when you leave the hospital. You may shower and pat the dressing dry just like it's part of your skin with a clean, dry towel when you're finished. Do not rub your wound or put lotions, oils, ointments, anything on your wound unless you've been directed to do so by your doctor. You should not take a bath or swim or put that leg underwater until your doctor says it's okay. It is okay to shower and let the water to run over the leg, but do not submerge it underwater until your doctor says that it's okay to do so. You may have some bruising, swelling, and some warmth on your leg after surgery. That is to be expected, and it will improve with time. Preventing constipation. While using the narcotic pain medications or the stronger pain medicines, you may experience constipation. Take your stool softeners, drink plenty of water, and stay active to help. If you have too many bowel movements, you can stop taking the stool softeners. Be sure to eat a variety of fruits, vegetables, and other foods high in fiber, such as beans and whole grain pastas. Steps to help healing. Prevent infection. In order to prevent infection, you should wash your hands before and after you touch any wounds, and your caregiver should do the same. Use antibacterial soap when showering, and do not allow pets near your wound. You should sleep on clean bed sheets after surgery. If you smoke, you should quit smoking or at least cut back to help your body heal. Eat a well-balanced diet high in protein and vitamin C. If you're diabetic, control your blood sugars. This will also encourage healing. And make sure that you are staying active. Make sure that you're doing all of the activities recommended to you by your physical therapist and your doctor. Steps to help healing. You can bear weight on your leg. Use your walker as directed by your physical therapist. And be sure to work hard with physical therapy. You should be doing exercises up to 3 times per day, even when it's not a therapy day. You should be moving every 2 hours while you're awake. Every day you should be able to move a little bit more, and your pain will get better with time. No driving until your doctor tells you that it is okay to drive. Do not drink alcohol or use any type of drugs after surgery. Especially if you're taking the stronger pain medicines, the side effects of both of those substances can increase the effects of the pain medications and cause you to fall or become too sedated. Warning signs after surgery. If you experience constant bleeding from your wound, if you have increased redness or very excessive swelling, if you notice a change in your mental status, or if your family members feel like that you are a bit confused, if you develop a fever over 101.5 or have pain or redness in your calf, you should call your doctor's office. Some drainage from your incision is okay. If you have constant bleeding, you should call. If you experience shortness of breath, chest pain, or any immediate medical problems, then you should call 911 or seek medical attention quickly.
Thank you for choosing Memorial Regional Medical Center for your orthopedic care. We hope that we have prepared you very well for surgery, and we wish you all the best when you get home in your recovery after your joint replacement.